So I have here, so that's the third political story. Excuse me for skipping around. So I have here 5 times that experts said that masks are pointless. These are all before COVID, and then the cult took over. The cult took over and steamrolled these experts and many more. And the cult, wearing a mask was never about, there was never a scientific reason to wear a mask. It was entirely a cult symbol. It was a cult membership tribal symbol that I hate Trump and I take this virus seriously. I'm not like Donald Trump. I'm not like those conservatives. I take this seriously and I care about other people. It was entirely a moral projection from the jump. Right? So scientifically, these are based on science, these are 5 times, 5 experts who said that masks were pointless. The first one, this is 2011. England had a pandemic flu plan. We had one in America as well, right? So if a pandemic flu ever comes, what do? We just take the plan off the shelf and here's what we got. And again, we have these in America as well, but this one is from England. Face masks must be worn correctly, changed frequently, removed properly, disposed of safely, used in combination with good respiratory, home hygiene in order for them to achieve the intended benefit. Research also shows that compliance with these recommended behaviors when wearing a face mask reduces over time in line with the scientific evidence. The government will not stockpile face masks for general use in the community. So why not stockpile masks? Because they don't work. In line with the scientific evidence. Why not stockpile masks? If they're the, oh, you gotta wear a mask. If they're so obviously the end all be all of protection, why not wear it? Because they don't work. And the British government knew that back in 2011. Second one, bring it up to January 2020. The UK nerve tag, new and emerging respiratory virus threats advisory group. So it's a panel of experts. They were asked about masks. This is from the minutes of the meeting. The committee reported that there's no evidence to support that the wearing a face mask by the general public reduces transmission. It's also noted that this may add to fear and anxiety. Instead, the emphasis on hand hygiene should continue. So this group, again, not just a bunch of schlubs on Twitter. This is the new and emerging respiratory virus threats advisory group. They explicitly said, don't wear masks because it'll increase people's fear and anxiety. Pretty amazing, right? Third one. This is a doctor, this is on the BBC. This is April 1st, 2020. This is a doctor from the London School of Hygiene and Tropical Medicine. Again, London School of Hygiene. Well, clearly they're going to be for masks, right?
One of the reasons that people wear masks is they think that it's going to protect them from virus. But the virus isn't floating around in the air. So it's not protecting me against anything because it's not there. It's probably going to be on my hand because I've shaken hands with someone who's got the virus and I have transmitted it. I have carried the virus to my face.
Notice how each one of these groups say that it's about touching things, touching people, and then touching your face. Hand hygiene. Each one of these groups talked about hand hygiene, not wearing masks. That video goes on to talk about the WHO. Says you don't need to wear masks unless you are sick, just to prevent large droplets from spreading the virus. And then she goes and basically says, just don't go around hacking on anyone and you're fine. This is the fourth example of experts saying masks are pointless. This is Michelle Oden. She's a professor of epidemiology and population health at Stanford, right? So she's an epidemiologist at Stanford. She's far left. Her Twitter profile has her gender pronouns and hashtag Black Lives Matter, okay? So she's politically very far on the left, but this is before the tribal allegiance told her exactly how she needs to behave and what she must do. She says, I'm in a room, this is early in the pandemic, I'm in a room full of epidemiologists and scientists, and not one person is wearing a mask. Lots of hand washing and sanitizer stations. If 800 epidemiologists aren't wearing masks, you don't need to either. Fifth example. 5 doctors published a letter in the New England Journal of Medicine. This was May 21st, 2020, so it was about a year ago. I love this. they're asking if hospitals should mandate people wear face masks when they're in the hospital. And they throw this in here. They say, well, we know that wearing a mask outside healthcare facilities offers little, if any, protection from infection. Public health authorities define a significant exposure to COVID as face-to-face contact within 6 feet with a symptomatic patient that's sustained for at least 10 to 30 minutes. The chance of catching COVID from a passing interaction in a public space is therefore minimal, right? So they're like, should people wear masks in hospitals? I don't know. Well, I mean, they definitely shouldn't wear them like anywhere else. Like, that's obvious. Should we wear them in hospitals? Yeah, maybe, because it kind of, it tells people, it reminds people that there's a pandemic, and it tells people that the hospital's taking it seriously. So yeah, I guess we should make them in hospitals. But anywhere else, like, no, of course not. Here's my favorite line of it all. This is them giving away the whole thing. It's clear that masks serve symbolic roles. Masks are not only tools, they're also talismans that may help increase healthcare workers' perceived sense of safety, well-being, and trust in their hospital. Although such reactions may not be strictly logical, we are all subject to fear and anxiety, especially during times of crisis. So put on your talisman before you walk into this store. Put on your good luck charm. Rub your rabbit's foot. Bring in your magic crystals. Bring in your dream catchers, your four-leaf clovers, what other pagan item you want to wave in front of you to ward off evil spirits. You want to bring your golden calf, garlic around your neck, whatever it takes to ward away evil spirits. They say, well, sure, I guess you can let people do that. That's all the mask was, and that's all it is. It's a talisman, says these 5 doctors in the New England Journal of Medicine. It's a talisman, a good luck charm, and a symbol of tribal membership. What a lesson this whole COVID experience has been about human nature and people's hysteria. And even with the experts, how they can flip instantly, not based on science, but based on politics and fear and panic. Let me end this. This is the, we got to go here, but this is the fact you need to know about COVID, the virus, today. This is from a professor at Johns Hopkins School of Medicine. Daily cases of COVID are now 1/10 the number of daily flu cases in the middle of a mild flu season. Not the same as daily flu cases. 1/10 of the number of daily cases of a mild flu season. And he says 80 to 85% of adults are immune. You got 60% of adults are vaccinated, and then half of unvaccinated adults have natural immunity because they've already been sick and recovered. So that's 80 to 85% immunity. Done. That's it. Herd immunity. COVID is over. Let's celebrate. But we can't, because the cult that's been wearing masks all this time says you must continue to live in despair. We must merely languish as a nation. Why? Because Trump wanted to open up. He wanted to open and celebrate and get back to normal. Trump was the nation's cheerleader. That's what he said. He said, I'm the cheerleader. I'm supposed to be positive here. We can do this. We're America. We can power through. So the left, the cult, has to take the opposite approach. They always have to be sullen and full of malaise. So be scared, be reluctant. Let's merely languish back to normal. How inspiring from our overlords. So we need to do the opposite. Go outside. Be healthy. Go places. Go in groups. Get with your family. Travel. Free of your masks. Free of fear. Put the panic behind us. And let's prepare for the next.
Wow. That was deep and insightful. I want more of that. Like,
Subscribe. Get more.